The Morning Brew with Bill Dean on News Talk 1340 and 96.3 FM, KWLM.
It is a chilly winter's morn. We've got clear skies, wind chills about -15 and 2 degrees here at KWLM. Joining us live this morning on the phone is Dr. Edward Schaefer, Chief of Urology at Northwestern Medicine. And Dr. Schaefer, based in the Chicago area, you're no stranger, I'm sure, to cold weather, but Happy New Year, and thank you so much for joining us today.
Yeah, Happy New Year. It's warm and sunny here. It's 20 degrees warmer than there, so it's 23 degrees here.
Like you said, it's about 20 degrees cooler than you were just, 24
That's right.
hours ago.
That's right.
Well, today's topic, prostate cancer, is certainly, one that it's like a lot of things. We know it's very important and that we have to get checked out on a regular basis, but it's one of those things you're almost afraid to talk about, for fear that you might have it or might be prone to getting it.
Yeah. Well, it may seem like everybody has it, and it certainly is the most common cancer diagnosed in men, but most prostate cancers that we detect are really non-life-threatening cancers, which is really good news for all your listeners out there. So I think when people hear that prostate cancer is so common and it affects a lot of people, they're often afraid to bring up the topic with their doctor. And I think if there's one message I'd like to get from this interview today is really that people should not be afraid to do that. And we like to talk about this concept of shared decision-making, where patients go to their doctor and they'll talk about, if screening and checking for prostate cancer makes sense for them. And if it makes sense for you, then, don't be afraid to do the testing. If we do happen to pick up a cancer, well, the good news is most of the prostate cancers that we pick up are not life-threatening. And overall, the 10 or 15-year survival for most people with prostate cancers, 98, 99%. So I think it's an important topic. I think it's something that individuals, men and women, they shouldn't be afraid to bring it up to their doctor to say, hey, should my husband or should I get, checked for prostate cancer?
I think you alluded to it already, but family history is certainly a real key player in this, like it may be in some other cancers too. How accurate is the PSA test, and how long has that been around?
Yeah, the PSA test is a very good blood test when you compare it to other blood tests that we use to screen for cancers. In fact, it's the best one out there that we can use to screen for cancers. Now, the blood test has been available effectively since around 1990, was when the FDA approved it for testing for screening for prostate cancer. So we've had the test for a long time, and that test has helped a lot. Prior to 1990, 40% of all the cancers that we picked up, prostate cancers that we picked up, were metastatic or were what we would call widespread at diagnoses. Now, with effective PSA blood testing, only about 3 or 4% of men who are diagnosed with prostate cancer today are diagnosed with it when it's widespread. So the blood tests work, and they really have helped to change the landscape of prostate cancer in America today. Now, the other thing you mentioned was family history, and family history is very important when thinking about your individual risk for being diagnosed with prostate cancer. But I would like to, just mention to your audience one other new thing that's out there that's new to the prostate cancer field, and that is really family history of other cancers. So we now know that families and individuals who have a strong history of breast or ovarian or pancreatic cancer, that those families may harbor genetic mutations that actually also increase their risk in men in those families for developing prostate cancer. So now when I see a patient, I don't just ask them, well, hey, do you have a family history of prostate cancer? I say, hey, do you have a family history of prostate cancer, breast cancer, ovarian cancer? And it turns out that about upwards of 8-9% of individuals who have prostate cancer will have a family history that's related to genetics that cause women in the family to develop breast cancer, for example.
What are there other signs or early symptoms, even that might be present that we should be looking out for, other than just the higher PSA number? Suddenly from one exam to another. Are there anything else we can kind of be alerted to, I guess?
Yeah, I think that would be the most common thing. Would be an abnormality in the blood test. Obviously, an abnormality on a rectal exam or digital exam would be another sign that maybe something's going on. And rarely, blood in the urine can be a sign. So if you have blood, if you can see blood in your urine, if you're a man, it could mean that you either have a bladder cancer or a prostate cancer, and that certainly requires a checkup.
Now, the Northwestern Memorial has also received a gift, I understand, of significance. Can you talk a little bit about that and what that's going to mean for the program there?
Yeah, we got a tremendous gift this year from Michael Polsky, who's an energy entrepreneur in Chicago. And his gift was really designed to build out a comprehensive urologic cancer institute. This is a physical space where we bring together experts that are involved in the diagnosis, treatment, recovery, genetics, survivorship of all urologic cancers, so prostate, bladder, kidney, testis. And additionally, the Institute is designed to really further the science behind these cancers, to really explore why people get these cancers and to develop new cures. So overall, it's a very exciting, very, very exciting event for us at Northwestern Medicine. We're really excited to see this come to fruition after a couple years of talking about it.
Yeah. Well, Dr. Schaefer, it's early in the new year, but it's a good reminder to get that exam checked, get that checkup scheduled, and that peace of mind is worth a lot, isn't it?
It sure is. It sure is. Over 75% of men out there, if they get their blood test checked, it's going to be fine. So people worry about it, but it's nice to know that your numbers are okay and you're in good shape.
Right. Well, Dr. Schaefer, thanks again, and the very best to you and yours. Thanks for spending some time with us today.
All right. My pleasure. Thank you very much.